Hello again, and welcome to this presentation, which will look at how the global clinical community can engage with SNOMED CT and SNOMED International. In this presentation, we will provide an overview of SNOMED International, an explanation of how the SNOMED CT community is structured in terms of member countries and national release centers, a review of clinical engagement, and a look at how you as a clinician can get involved. SNOMED CT is owned, maintained, and distributed by SNOMED International. SNOMED International is a not-for-profit organization. It is owned and governed by its member countries. For more details on current member countries, please consult the provided link. SNOMED International is a completely virtual organization with its staff spread across the globe. SNOMED International's vision is that by 2025, clinical terminologies will be used globally, which will result in better health and improved patient outcomes, supported by one language of health. SNOMED International's mission is to sustainably produce a global clinical vocabulary and other services that enables the clear exchange of health information for all. We'll now explore the topics of SNOMED International membership and what it means to be a national release center. SNOMED International is a member-owned organization, which has representatives working at a regional level to support member countries, and in addition, vendors and clinicians. Our dedicated customer and stakeholder relationship management team includes regional representatives, clinical and vendor engagement programs, and collaboration support for our members. Within a country, the membership of SNOMED International is normally held by an agency of the government, corporation, or regional government agency, which are endorsed by the national government. Which leads us to National Release Centers, or NRCs. These are the official point of contact within a member's jurisdiction, and they have the responsibility to serve as the interface between SNOMED International, the national users and affiliates, and other members. SNOMED International requires each member to have a nominated organization that fulfills a small set of core NRC responsibilities, mainly in the area of SNOMED CT adoption, deployment, and distribution. Some NRCs have other responsibilities related to SNOMED CT, and also manage the use of other health informatics standards within their country. An NRC can be established as a new body or organization within the member country, or it can be folded into an existing organization. As the primary contact point for both national affiliates and SNOMED International, the NRC plays a central role in effective and efficient collaboration with the various partners. When you visit snomed.org/members, you can access a list of the current member countries. And as you can see here, there are countries in the Americas, Europe and the Middle East, and Asia Pacific. In addition to its members and licensees, SNOMED International also has a number of collaborators. These range from clinical organizations to large global vendors. The drive for collaborations is to support interoperability and enable end users of SNOMED CT to interact with other terminologies and information standards. SNOMED International continues to explore the use cases for future collaborations. SNOMED International directly supports collaboration between its member countries. This is supported through the Member Forum, a formal governance body that brings together representatives from all the members' national release centers. The Member Forum normally meets face-to-face twice a year, but also has online meetings and project-based calls to further collaborative efforts. Implementation of SNOMED CT involves considerable time, effort, and allocation of resources. And because we acknowledge this, we support the idea of members working together. As a clinician, you have a choice of working at an international level or a national level, and this depends on your interest or what's going on in your country. Note that when even working on content that will be used at a national level, there is still opportunity to collaborate with other countries, and we'll have an example for you in just a moment. There are many reasons to collaborate, and by using a community approach, we can solve problems together, share our implementation experiences, and in many cases, avoid duplication of effort. Some examples of member collaboration include sharing content and documentation developed as part of a national extension with other SNOMED International members, or projects where the requirements are relevant to more than one member, such as the French Translation Collaboration Group, who are working together to translate content for use in their respective countries. In addition to formal arrangements with organizations, another key driver for collaboration is engagement with clinicians and professional bodies. Where possible, the preferred aim is to reach out to international organizations to ensure that the requirements and discussions are centered around international needs. However, we also enter into discussions with national clinical bodies in the absence of an international specialist body to enable the specialty requirements to be evaluated. In addition, we also reach out to individual clinicians who have an interest in SNOMED CT or simply wish to enhance the clinical coverage of a specific specialty area with SNOMED CT. We continue to develop documents, presentations, and other supporting information to assist clinicians in working with SNOMED. As mentioned in a previous presentation, we have created formal groups to interact with clinicians. These are the clinical reference groups, clinical project groups, and editorial groups. In addition, each member country may also have clinical engagement outreach activities. Some of these are focused on specific national requirements. However, a number will also coincide with groups at the international level. At a member level, the focus of the discussions may be on the development and review of SNOMED CT content or specific implementation issues. To check what clinical engagement activities are underway in individual countries, please check on the NRC's own websites. Details of the national release centers can be found using the URL provided. For SNOMED International, the driver for all clinical engagement is the continuous review and updating of SNOMED CT content to support clinicians using SNOMED CT in electronic health records at the point of delivery of patient care. Clinical communities and individual clinicians can improve the quality of SNOMED CT simply by suggesting changes to the terminology, either as new content requests or for changes to existing content. This is extremely valuable, and we would encourage all clinicians to adopt this approach, especially if they notice an issue within SNOMED CT. There are also clinical reference groups which continue to grow and support review and discussion at a specialty level. The key to using the approach of clinical reference groups is the acknowledgement that we all have experiences and can learn from one another. The delivery of healthcare is complex, and the delivery of specialty care differs across the globe. We encourage clinicians to join clinical reference groups as a way to understand the global picture in a particular domain that can then inform developments within SNOMED CT to best support clinicians in every country. Clinical reference groups provide the framework for discussion and provide a mechanism for different levels of engagement based on the needs of individual clinicians. They can support formal meeting structures, simple discussion threads, or even the ability to simply ask for clarification or assistance from members within the group. The groups are an essential part of the support for SNOMED CT, and in addition, also support the developments of other supporting projects, such as maps, reference sets, and implementation guides. In this final section, we'll explore how clinicians can engage with clinical reference groups. There are two important points related to CRGs. The first is how to get involved in existing groups. The tooling we use to support clinical reference groups is called Confluence. To join a group and partake in discussions, You will need to complete an online form by clicking on the link provided. You should include on the form which group you wish to join. If, however, you already have a Confluence account, please email info@snowmed.org and tell us which group you wish to join. If you feel there is a requirement for a new group, please open the conversation by emailing us. As part of your communication, please provide us with the background on which specialty you are interested in, why we need a group, and what type of discussions are required. We will then discuss the requirements with you and provide a way forward. Details of the current clinical reference groups can be found in the CRG directory at the link provided. They are alphabetically listed and are grouped by type. That concludes this presentation, which focused on clinical engagement. And thank you very much for listening to this series of presentations, which has been aimed at clinicians with an interest in using SNOMED CT. Hopefully, we have raised your awareness, and we look forward to working with you in the future.